Hey everyone, this is Dr. Sisson here from Sisson Associates, and today we're going to talk about jaw pain. And I'm starting to see more and more folks in the clinic with jaw pain, and typically, females have a higher risk of jaw pain, and as you get a little bit older, you have a higher tendency to develop jaw pain. So here's a few tips and tricks that you can use to reduce that aching pain from coming up. So the first thing we want to do is avoid chewing gum. Whether you're at work or in the car, sometimes you just start popping pieces of gum. You don't realize you're chewing as often as you are. And the muscles of the jaw, just like any other muscle, if you use it too much, then it can develop an ache or pain in that area. So try to cut down on your chewing of your gum, and I think you'd be surprised at how much reduction you can have in pain there. So the second thing we want to do is we want to watch grinding of our teeth. That's one of the biggest culprits behind jaw pain. And there's two scenarios where I most often hear about the grinding. One is in the car. So I know here in Montrose, traffic isn't too hectic, but a lot of times people, while they're driving, they got a tendency to grind their teeth. That puts a lot of stress on the muscles in the joint, and that can develop an ache or pain. Especially the human jaw can produce up to 200 pounds of force, so you can kind of see where that can come from. And a good tip I give a lot of my patients as I'm treating their jaw pain is to go ahead and get your tongue and put it on the roof of your mouth while you're driving. So that's a little postural modification. If you do that, you're more aware of the positioning of your jaw and your teeth, and you'll notice and pick up on the grinding quicker, and you can stop. So another place that I typically hear about grinding happening is at night. There's some folks that just grind their teeth. There's no way around it. And if you wake up in the morning first thing and your teeth or your jaw is hurting really bad, then that could be a sign that you're having a lot of that at night. But if that's an issue you think may be a part of this, it's best to call your family's dentist and go ahead and contact them. They can give you a better idea of whether there's grinding or not, and they can help you with a custom guard at night to protect you. Along with that, I've had patients in the past with jaw pain. We were able to treat them, and the pain went completely away. But, a month or two down the road, it came back. And what I found out is that if you have sleep apnea, that can get your jaw in a really bad position and produce constantly that jaw pain. So if you suspect you may be sleeping poorly, you may have sleep apnea, it's best to speak with your family's physician to see if that's the case. And if it is, then you guys can address that, and that will have a big impact on your jaw pain. The next thing here is just like physical therapy, I try to promote wellness. It's very important. If you can prevent a problem, it will save you so much time, so much money. The same is true with dentistry. If there's a dental cause of your jaw pain, there's a few things that you can do to reduce the risk of developing that sort of pain. I want to thank Irene Chandler and Judy Knight from Warsaw. They gave me a lot of good information on the wellness side of things from dentistry. So some of the things they taught me was you want to, obviously brush and floss twice a day. That's important. You can use a pick in place of the, or along with the floss, and that's going to go ahead and make those gums nice and healthy. Along with that, we actually want to decrease our alcohol intake. So, reduce the amount of alcoholic drinks you're having, but also your mouthwash, you want to find a mouthwash that doesn't have alcohol, so alcohol-free. That's going to go ahead and help keep the healthy bacteria in your mouth, and it's going to keep it nice and moist. That's a big part of good dental health. Along with that, there's a lot of studies that show automated toothbrushes work great. You just got to make sure you do those twice a day. But again, they help a lot with your dental health. Another thing is, if you are going to use gum, I say use it sparingly, and you try xylitol gum right there. I was told that's really good at maintaining a good pH in the mouth, keeping it nice and moist, and that's going to be great for dental health. One of the last things I have here, typically when a patient comes in to see me for jaw pain, a lot of time there's a big component in the neck. So poor posture, issues with the neck is causing pain in the jaw. So I would say look at our previous video on ways to reduce neck pain, and that will give you some good postural tips and tricks that you can use to help kind of help with the jaw pain if you're having that. But that's about it. If you have any issues such as jaw pain and you try these, they help, but you still have it, it's best to either contact your dentist or your physical therapist. And if it's an orthopedic problem, I can treat it. If it's not, I can refer you to a dentist, and it's the same vice versa with a dentist. So I want to thank everybody for listening today, and I will talk to you soon.